Hello everybody and welcome to Mansfield Central Library. My name's Sarah Collis. I'm the chair of Healthwatch Nottingham and Nottinghamshire. It gives me absolutely brilliant pleasure, if I'm honest, to welcome you here today and to see so many people that have turned out. So for those that didn't hear the first bit, welcome to Mansfield Central Library for what I think is going to be a really interesting afternoon, hearing about the work that Healthwatch Nottingham and Nottinghamshire has done within a context of a continuing challenging environment as COVID continues to affect the lives of so many of us, and also with an increasingly concerning situation that everybody's facing around the cost of living crisis, which we understand will be affecting people's ability to look after their own healthcare and to access services. So it's that backdrop that Healthwatch in Nottingham and Nottinghamshire has been working, and the activity that we're going to showcase this afternoon really demonstrates the variety of work that Healthwatch does, the way in which we have impact from working with young people who are homeless up in Newark, right through to people living with long COVID, which is a relatively new condition, working with a very new system that is finding its way and creating new opportunities for patient voice to be heard. So this afternoon we really demonstrate, I think, why Healthwatch exists and why it's even more important now to be elevating the voice of people that use health and social care services and understanding what matters to them. And that's why I'm really pleased to welcome you to this afternoon, and I'd like to invite Jane Lawton, our Chief Executive Officer, to come up and start the proceedings.
Thank you, Sarah. Can I confirm you can hear me at the back? Yeah, thank you. So I just wanted to spend a few minutes just explaining who Healthwatch is and what we do, and then to introduce some of the themes that we're going to be talking about during the day. So I think most of you know, but if you don't, Healthwatch Nottingham and Nottinghamshire is your local independent patient champion. And we have three main roles. We hold local health and care organisations to account on behalf of people. For example, hospitals, GP services, social care. And then we go on to seek out the views and experiences of communities and the public, and use what these people say, what you say, to press for improvements. And thirdly, it's not exactly a role, but we aim always to work in partnership, whether it's in partnership with other community groups, whether it's in partnership with the patients and the public themselves. So just a little bit more about some of those things. So holding to account, what does that mean? So the NHS and social care has a responsibility to communicate and engage with local people. And you'll probably agree that there's a range of ways in which that works well, and there may be ways in which it doesn't work so well. But our job is to make sure that you have your chance to have your say as a member of the public. And we want to make sure that they're transparent in the way they make decisions, and make sure that people are involved in those decisions. So to do that, I meet regularly with chief executives of the acute trusts, for the mental health trust. Sarah Collis sits on the health scrutiny committees of the two local authorities, where we sit alongside the locally elected members in scrutiny of healthcare. So that all sounds very hard-hitting. The other side of what we do is to go into communities and seek out their views and experiences. And so we have an engagement team, we've got Abdullah Richard here, and volunteers who help and take part in that activity to really understand what it's like for people living in Nottingham and Nottinghamshire. And we often try to focus on reaching those people whose voices are much less often heard, possibly not heard at all. And when we got this information, we use it to seek improvements. So we take it back to those who have the power to make things change. And as I said, we don't do this alone. We work in partnership with community groups, organisations, etc. And we also work in partnership with Healthwatch England, which is the national umbrella organisation for all the local Healthwatch throughout the country. And I'm delighted that Jacob is here today from Healthwatch England. He's going to tell us about the difference they can make when they pull together the collective views of people from across the country. So, on to today. We're going to share a few of the many areas which we've been involved in over the last year. A couple of areas which are particularly important today and which we get more comments and feedback than anything else, I think, is getting a dentist appointment and getting a GP appointment. I'm sure you've all had experiences which you would share around those. So we've completed a survey of people's experiences of trying to get a dentist appointment and published that in June. And we found that almost half of people told us they could not get an NHS dental appointment. And we know from other work that actually NHS dentists aren't taking on new patients. And our concern is that when you can't get an NHS dental appointment, it's the poorest in the communities who suffer the most because they can't afford to go private, which other people may do. So this whole problem is creating a problem of inequality across our communities. So Jacob will talk about what happened when we fed those back and what they were able to do nationally. So coming on to general practice, Abdullah a little bit in a short while will be telling you what we found when we asked people about their experiences of getting a GP appointment or accessing their GP service. And we're also delighted that Lucy is here from the local medical committee, a body that represents GP practices, who will help to sort of comment on those findings. We focus on people whose voice is not usually heard. And there's various bits of work going on at the moment, which we won't be reporting today because they're still in happening. So we're doing a piece of work around digital exclusion, where we're working with groups of people who have barriers to accessing doing things on your smartphone, doing something on the computer, for example, booking an appointment or whatever else you might need to do to seek out health information. Working with people who are visually impaired, people with learning disabilities, what are the barriers they face to using that sort of technology? We've been talking to young people who are homeless, and you'll see the artwork on the other side of this board here, which is some of the ways they've expressed what matters to them. And finally, we're currently doing a piece of work reaching elderly people over 75 who are in receipt of domiciliary care, so they're getting home care provided by local authority social services. And we really, really want to reach these people. So if you have any connections that will help us to reach more of these people who can be very isolated and their care goes unseen, we want to hear from you. So finally, you'll have the chance to have your say at the midpoint of the meeting, and we particularly want to understand how you feel the cost of living is going to impact on you and the communities that you represent in terms of accessing healthcare. So we hope that you enjoy the afternoon. Please take the opportunity in the break to read some of the material around the walls. We've got quotes from our volunteers who work with us. We've got quotes from some of the stakeholders in the system who we work with, some of the decision makers, where they've given some views on how they think that we help them and are an effective ambassador for the local public. So thank you very much. Enjoy the afternoon, and Richard will announce the next item.
Thank you, Jane. We turn now to an issue that predates the pandemic, but which was made far more challenging by the advent of COVID-19, NHS dentistry. For myself and my colleagues who handle inquiries from the public, it's fair to say that dentistry has been the single most frequent issue raised with us. particularly, of course, finding a dentist who could take on a new NHS patient. We were not alone in finding this. Across the whole local Healthwatch network, colleagues struggled to offer useful guidance on accessing dentistry. Healthwatch England undertook a significant piece of work and produced a report reflecting the issues with dentistry across England, and I'm pleased that Nottingham and Nottinghamshire's own report helped to inform this overall picture. So it gives us great pleasure to be able to welcome to this meeting Jacob Lant, who's Head of Policy for Healthwatch England on accessing primary care, to talk about this important issue. Jacob.
Right, good afternoon everybody. So I'm Jacob and I'm from Healthwatch England. I'm going to talk about dentistry. It's a sort of a running joke in Healthwatch England and sort of circles of people in my office, and that I'm obsessed with teeth. I'm not, it's just I have to talk about it because it's such a big issue for the public, so it dominates a lot of our work. Just a bit about me. I've been with Healthwatch about 10 years. So I helped to set up local Healthwatch, working for the Local Government Association, and I've been at Healthwatch England for the last 9 years or so, working on a variety of different health and social care issues. So Healthwatch is a big part of my life, and it's wonderful to be out here back engaging with local Healthwatch. One of the best things about working at a national level is that I get to see everything all of you are doing. So it's not just the two Healthwatch in Nottingham and Nottinghamshire, it's actually the 152 right across the country. The slight challenge with that though is that is a lot of noise. So there's 152 organisations working on 152 issues all of the time, and they're all important. So how do we decide which one do we focus on? How do we make sense of it? And it can feel incredibly daunting at times with noise coming at us from everywhere. But the point on dentistry that I want to talk about is what we can achieve when we all line up behind the same issue, all talking about it at a local level, a regional level, national level, and the difference that we can make when we do that. So a little bit of background on dentistry as an issue. The first piece of work I did on dentistry was in 2016. And at that point, we knew it was an issue for certain groups of people around the country. So we knew in some areas of the country, access was a real problem. So places like Cornwall, Kirklees, Bolton, these areas had been consistently reporting to us access issues to dentistry. We also know it was a problem for certain groups of people who can't access high street dentists. So care home residents were a classic example. You know, we didn't have dentists going into care homes. We couldn't get care home residents out to dentists, so they were missing out on services. And there was a significant group of people who had just fallen out of the habit of going to the dentist. So they had fallen off the map. And they were all struggling, but it was also clear that dentistry wasn't a national crisis, right? So it was very clear to make that point. It wasn't the whole system was in meltdown at this point. But then between 2016 and 2019, we started to hear more and more coming from the network. We started to hear more stories, more people struggling to find a dentist, more problems with the service that was on offer. But nothing quite prepared us for what we were then going to hear during the pandemic. Pretty much overnight, it went from about dentistry feedback went from about 5% of what we were hearing across the country to 20%. So that's 1 in 5 calls to local Healthwatch, 1 in 5 contacts to the website, 1 in 5 contacts on social media was about finding a dentist. And that is, considering we cover so much in health and social care, that was a real alarm bell for us that there was a problem here. It's not just the volume of the responses, it was the sentiment too. So we track whether people are happy or unhappy with what they're telling us about services, and less than 5% of what we were hearing about dentistry was positive. There's only one other service that kind of even gets close to that level of negativity, and that's mental health services. And so again, another major alarm bell for us. That feedback has remained at that level. So it wasn't just an issue for June in 2020 when dentists started to open up again. Today, it still occupies 20% of our feedback. It's still overwhelmingly negative. So this crisis that we saw is continuing. And a lot of the themes that we hear are things around information about finding a dentist. How do you register with a dentist? How do you find a practice that's willing to take me on? We heard issues about affordability. People couldn't afford to go private, so they're having to wait ages on the NHS, but actually people also struggling to afford the NHS charges. And in terms of some of the impact on people, we heard very briefly from Jane about the inequalities that are opening up in access to dentistry. And also for us at a national level, because we hear stories from everywhere, the really horrific sort of stories of DIY dentistry that came out during the pandemic. I'd love to say they were only one or two examples. They weren't. Everything from home filling kits to people self-medicating with alcohol, pain medication, performing self-extractions. Some of this stuff was pretty medieval in the way that these stories came across, and very heartbreaking to see. So it was mentioned that we did a report on this. We actually did 5 reports over the course of the last 2 years, and all of these have been informed by the work of local Healthwatch, including the report highlighted there from Nottingham and Nottinghamshire. In total, we have 471 reports from across the country in the last 2 years mentioning dentistry. Gathered this feedback from about 70,000 people across the country. We took a deep dive looking at 8,000 people's experiences for our national work, and I want to talk to you about what difference that made. So what difference does it make when we all come together? I'll skip through that one. So the impact. So the first thing, record press coverage. We often have had conversations in the past about how no one knows who Healthwatch is, how do we raise our profile, how do we show that we're standing up for patients? And dentistry was an issue that meant we were on the front page on multiple occasions of a number of national newspapers, raising this issue, making sure that people could hear what was happening on the ground and that community voices weren't silenced. Over the course of 2 years, I think we've seen over about 1,000 pieces of coverage across the country on dentistry that is driven by Healthwatch activity. So Healthwatch taking people's stories and placing it in local papers, on local radio, really getting the voice out there. And in the summer, you may have heard a piece of work done by the BBC News. We managed to raise enough noise about this problem that the BBC commissioned an entire team of journalists to ring every single dental surgery in the country. That's 8,000 practices that they rang. And I've been working with the media for about 15 years, and I've never known them commit that much resource to one story like this. And that comes from all of the coverage that's generated by the Healthwatch network. It's not just media coverage. So that media coverage helps us influence people in decision-making positions. And I've drawn this slide here. It's a graph of some analysis of Hansard, so the parliamentary record. All that press coverage and all the work that you've been doing at a local level, the whole network, and here in Nottingham and Nottinghamshire, with local MPs to raise this issue, what we saw as a result of that was more mentions of dentistry in Parliament in the last 2 years than in the entire preceding decade. So that it's in MPs' inboxes. It's something they're talking about. And why does that matter? What change can they bring about? Well, there was some impact from that. The first thing was that in the summer, following the BBC story and all of the work that we've done, is we secured the first change to the dental contract in 16 years. I've been negotiating the new contract for 9 years. That's how long heels have been dragged on this particular issue. And so the campaign managed to actually get them to sit down, negotiate some changes to the contract. They are only small changes, but they do make a difference to the way that information will be provided to people about how to find a dentist. There is changes to the way that dentists are paid so that we incentivise the treatment of more complex cases. It was too easy before for dentists to say, no, you've got too many problems with your teeth, I don't have the time to see you, and then those people were lost in the system. So actually the changes will help those people. And there was a commitment to doing more on reform. So that was the first thing. The second thing is that in the leadership contest during the summer, both Rishi Sunak and Liz Truss, following on from our campaign work, committed to fixing NHS dentistry. And it doesn't stop there. So Liz Truss is now our new Prime Minister, and the pressure continues. So MPs raising the issue continue to say and hold Liz Truss to her promises to fix NHS dentistry. And the new Secretary of State, Theresa Coffey, listed her priorities, and ABCD priorities, you may have heard that mentioned on the news. The last one, D, stands for doctors and dentists. I can guarantee you that if we hadn't done the work on dentistry, because all those thousands of people contacted us, dentists wouldn't be on there. I've worked on this for 10 years and been in some very boring meetings, in some very dull rooms, talking about dentistry to a closed group of people, and nothing changed in 8 years. Last 2 years, the noise you've created as a network has been fabulous and has put it on the map. Now, that doesn't mean the journey is over, and I'd love to say that change happens quickly. It doesn't. It's incremental. But we have made this a problem that can't go away, and we have to have some solutions to it. And we will be holding Teresa Coffey to account on her promises here to address the dental crisis. We will be holding the Prime Minister to account on that because it matters to people. But dentistry was... I'm going to end on dentistry there, and we'll want to share one more thing about long COVID if I can. So dentistry was easy to identify as an issue because thousands and thousands of people were talking to us about it. It was screaming as an issue. But we also have to listen carefully to those people who aren't screaming about an issue. The new problems that are occurring, the communities that don't have their voices heard, and we need to really investigate those issues as well. So, dentistry is a mass popular problem. Long COVID, which I'm going to talk about, is not something that was on the radar previously. And again, this is an example that comes from Healthwatch Nottingham and Nottinghamshire and your work on raising long COVID as a concern. So, we didn't have 8,000 bits of data here. We had 122 people contact us at national level. So we were really reliant on the in-depth work that Local Health Watch did on long COVID. And it was Nottingham and Nottinghamshire were one of 10 Local Health Watch to look specifically at this issue. The evidence provided from that, from your community, we were able to present back into NHS England. We were able to tell them that GPs, by and large, they are struggling to know what all the symptoms of long COVID are. They're unaware of what support is out there and how to refer people into it. People were telling us about their mixed experiences of long COVID and the mixed experience of the support that was on offer when they did access it. People were also able to tell us that long COVID affects their whole lives, and actually services weren't providing holistic care to help them. And finally, we also identified, even within this small group, some people affected by health inequality. So certain groups having a worse experience of long COVID and long COVID support than others. And the outcome of this, I say change is slow, but the evidence that Local Health Watch gathered fed directly into a decision from NHS England to invest £90 million more in long COVID services this summer. And the commitments made in that plan address all of the recommendations that you made, that then we made at a national level. And so I hope with those two examples, dentistry and long COVID, that I've presented like an example of what we do with every single call, every single bit of feedback you hear at a local level, how that helps us then make a difference at a national level. And I can't thank you enough for all the work that you do. And I'll end my presentation there.
Thank you, Jacob, and thank you for bringing up long COVID as well. I think that's an issue that perhaps we maybe should have mentioned a little more in depth about this, because we did do, as it said, some work around this. Dentistry wasn't the only issue that came up frequently in conversation with the public. Unsurprisingly, we also encountered a lot of comment around accessing general practice. COVID-19 created some new issues and threw others into sharper focus. We needed to examine how this was impacting our local communities. And so this year, we undertook a study to look at this question. To discuss the results of that study, I'm pleased to welcome my close colleague, Abdullah Saidi, and from the Nottinghamshire Local Medical Committee, Lucy Cassidy.
Hello everyone, my name is Abdullah. I am Outreach and Engagement Officer at Healthwatch. So, for today, I would like to present for you the finding for our most recent hot topic we have, which was about GP services. It was about accessing and using GP services. So first, why this topic? Why GP services? What we wanted from this survey is not only to listen to the challenges that are facing people using and accessing GP services. Actually, we wanted to understand and listen to people what has worked well during using and accessing GP services. And that was based on conversation we had with the place-based partnership and members from the local medical committee. In a brief, the survey was 8 questions. It was mixed methods. That means we asked people quantitative and qualitative questions, and we received 399 responses. So when we asked people what worked well for you, when we asked people what worked well for you, they shared with us different areas and topics that considered to be worked well. For example, staff skills and attitude, as we see here in these 2 quotes. The first person said they have been with this surgery for 40 years, and they say receptionists, nurses, and doctors are highly professional, efficient, and caring. Also, this person said the staff are very friendly and always try to help. Besides staff skills and attitude, people share with us the positive things like good service. So the service in general was good for them. Telephone services. So for some people, what worked well was the fact that they are able to attend appointments or book appointments through the phone. However, for some people, what worked well was face-to-face appointment. And that, I think that shows that people's preferences in terms of face-to-face or telephone appointments are varies. Also, some people told us what worked well for them was the quick response, the online triage and consultation and booking system, something like Ask My GP, the appointments availability and prescription and things related to prescriptions. Like we see in these 2 quotes, someone says online appointment booking, reception is friendly. The other person said they have been dealt with in a polite way. However, people also shared with us some challenges faced them during using and accessing GP services. For example, challenges related to booking appointments. That include long waiting time on the phone. Like we see in this quote, this person, they were on hold for like an hour, and then there are no appointments available. The limited time window to call to book an appointment, as we see in the first quote, the person said they can only call at 8:30, and they can't do that because of they can't fit that with their work commitment. Other challenges, like there are no appointments available, or if there is an appointment, they have to wait long time for that appointment. And for some people, they were promised to be called back, or no one called them back. Also, another finding in this hot topic survey we found, before this hot topic survey at Healthwatch, we had a previous study. And on that study, we reviewed all the websites for all GP practices here in Nottingham, and we found that 84% of GP practices, they offer the option to book an appointment online. In this hot topic survey, when we ask people, how do you look for information, 70% say they look for information online. That means 70% of the respondents for this hot topic, they have access and use internet. And then in another question, when we ask them, how did you contact your GP? They contacted their GP by phone. 71% they contacted their GP by phone. So the question here is, since booking an appointment online is available, why people are still relying on calling the GP rather than booking an appointment online? And I had a conversation about that just before I moved to this. I had a conversation about that with members of the public, and they say because this is the habit. People are used to phone the GP. And some people say they believe in the power of a human voice. I'm just not sure where I am now. Okay. Yeah, and in terms of face-to-face appointments, online appointments, or telephone appointments, as I said earlier, this hot topic survey showed that people have different preferences in this matter. Like when we ask people what worked well for you, we see some people say online appointments, while other people say talking face-to-face. In another question, when we ask people, did you get what you wanted? Some people said, I prefer if this practice embrace more technology, while others says, I would like to discuss things face-to-face. Another finding we found in this hot topic survey was about contacting other services before contact the GP. So out of the 399 people who responded to this survey, only 62 people have contacted other service before contact the GP. Like the first person there, they say, why would they go to the hospital if they have an issue and the GP can deal with? And the other person say they don't prefer to look at the internet and self-diagnose. So what did we do, we as a Healthwatch, with this survey? We had several meetings with members from the ICB, the Integrated Care Board, and members from the local medical committee, and they shared with us that there is still ongoing shortage in the number of GPs who are available. However, they also share with us that GP practices now, there are different rules and different healthcare professionals who are able to provide health services to the patients. That means it doesn't have to be the GP themselves. And we also had a meeting with members of the public, and they shared with us that they would like to be treated as a people, not as a medical conditions. And that also, if it's applicable to choose between telephone, online, or face-to-face appointment, they would like to be given the chance to choose between these different model of appointments. And now I will pass the mic to Lucy from the local medical committee.
Thank you, Abdullah. Hi, everybody. My name is Lucy Cassidy, and I'm the Practice Liaison Manager for Nottinghamshire Local Medical Committee. For those of you that don't know what the Nottinghamshire Local Medical Committee is, or the LMC, we're the local representatives of general practice. So our role is to represent, advise, and to support GPs. When Abdullah invited me to take part in this presentation, I felt like my role is instantly to defend GPs. And your role is to represent the general public. But what I've realised as you were talking, that one of the main things that we all have in common is that we all want the best care for the patients. That's the main goal of everybody in this room. We all want the best for the patients. So I wasn't surprised, and I was very encouraged to see the feedback that overwhelmingly it was positive about the support that our GPs give us. The reality is that there aren't enough GPs. That is the reality. And I wouldn't be doing my job properly if I didn't tell you about the realities of general practice. So sorry, Abdullah, I'm going to say a few statistics because I think it's important for you to be aware. So we do have a shortage of GPs. So we have 1,850, I have to put my teeth in for this bit, fewer fully qualified full-time GPs in 2002 compared to 2015. 1,850 fewer GPs over 7 years. That is staggering. Over the last year, we've lost 314 GPs across the UK in 1 year. Despite this, I'm so proud of the work that my GP colleagues do. Our GP practices since 2015 have 2,222 more patients on their books on average for every GP practice. NHS Digital take data every single month about access and appointments, and in August 2022, so this August, 26.5 million appointments were seen by general practice in England. 26.5 million appointments. That's a 13% increase since 2019. And that just shows how hard our GPs are working. The reality is that demand outstrips resource that we currently have. And I think it's really important that I'm honest with you. Our GPs want to see you. We frankly don't have enough of them. So politics over, and Abdullah, I know we said, how can we work together? How can we look at solutions? So one of the things that we have done together collectively is to help the general public understand that there are other people that you can see in your GP practice. So I really liked the word that you used about habit. It's habit to call to pick up the telephone and speak on the telephone to make an appointment. It's also habit to see a GP. And there's lots and lots of other people in the healthcare system that want to help you, want to see you, want to support you. And one of the ways that we can work with Healthwatch to do this is to work with the general public to help them understand the different roles. So it might be that you see a physio, it might be that you see a nurse. When the general public ring and the receptionist asks, why do you want an appointment? It's not because they're being nosy, it's because they're trying to signpost you to the best possible person. So thank you very much for inviting us to be part of this project, and I'm really looking forward to other projects that we work on together to get the best care for the general public.
Abdullah and I stay with you for the next item. Let me first talk to you about the part of Healthwatch Nottingham and Nottinghamshire that Abdullah and I serve. We're both outreach and engagement officers. Outreach and engagement are the people who go out and speak with the public and with members of specific groups. Our goal is particularly to talk and work with members of communities that are seldom heard, or as I prefer, seldom listened to. We are also the staff who primarily deliver the engagement in project work, from facilitating focus groups to interviewing members of the public. And of course, we do this with the support of our volunteers. You can see behind you on the other side of the dividers some posters generated by one such project that we undertook. That asking young people their thoughts on the challenges of accessing and using health services. These posters are their own imagery explaining their concerns, both specifically and generally. Where we can, we want to empower communities that we work with to be able to speak up for themselves. Now, you've sat down here and listened to us talk. What we would like actually next is some help from you. What we would like to ask you is on a topic which is already impacting many and will raise problems for many more over the course of this winter and beyond. And by that I mean the cost of living crisis. Jane has already mentioned that we would like to gather your understanding and experience to inform our conversations with the system locally and nationally. On the walls at the back, there are 9 headings that we've extracted from current literature and research on the cost of living crisis, issues that will have impacts on health and well-being, and therefore the parts of the system that we're concerned with. You will find on your table sets of 3 dots or stars, yes I know some of you have actually ended up with stars instead, to which you can use to vote on which issues you think, for you, are going to be, or already are, the most significant. Only 1 dot on a poster, so you can vote for up to 3 issues. As you can see, there's a poster beneath each heading where you can stick your dots. Additionally, some of you here represent various communities or deal with specific communities as part of your professional role. So, and this is a matter of honour, there's a second section labelled where you can vote 3 additional dots about what issues you think either you've already heard or will hear about for that community. We're going to take a short break now, 15 minutes, in which you'll have time to grab a drink and take a comfort break, but we would like you to take time to look at the headings and to vote. In addition, on each table, there are some pens and post-it notes. If you want to share a short additional bit of relevant insight on any of the headings, please do so. Together, you can help us get a feel for the issues that we should be looking out for. A last quick reminder. If you want to submit a written question to the panel for our question and answer session, can you submit it at the start of the break? We'd also like to hear from you about how this showcase has gone. So if you wish, use that same sheet to feed back to us how we've done today. And of course, if you have any problems, do please look out for any of us wearing the lanyards. We're very happy to help you. And my colleague Kerry is showing you the box where we would like your vote. She's modelling it beautifully. So many thanks, and we will speak in 15 minutes. Thank you. Thank you, everybody. I hope actually you've enjoyed that break, actually, and thank you to all of you who voted. I'd now like to introduce Deb Morton, our volunteer manager, who will tell you more about our volunteers. This team of people are hugely important in helping Healthwatch Nottingham and Nottinghamshire have the reach and the capacity to undertake the many, many tasks that are our responsibility.
Yes, thank you, Richard. As Richard said, our volunteers are hugely important to us here at Healthwatch Nottingham and Nottinghamshire. They support all aspects of the work that we do, and we really could not function without them. You'll have seen through the break the animation, giving you an idea of the activities that they've been involved in and how much of their valuable time they have given freely to us over the past year. But it's much more than that. Our volunteers share their time, they share their skills, their experience, their knowledge, their ideas, and their support for us as a team. We thank each and every one of them, no matter how much they do or how little that they think they do. And I say that because this is what I hear. Some of our volunteers say to us, I just do this. But just doing this or that goes a long way to helping us have the impact that you've seen today. So we're now going to run a short video where some of our volunteers will tell you what volunteering with Healthwatch Nottingham and Nottinghamshire means to them.
After I retired, I was looking for something new to be involved in. I decided that yes, I would become a volunteer with Healthwatch. So I volunteered with Healthwatch, and I went through the training program, and then waited to see what the next research project would be. And it was to do with care homes. We had to go into the care home and interview the patients, the residents, about what was happening to them, about the quality of care. And so that was what I wanted to do. I wanted to be able to listen to people reflecting on how they found themselves in the care home and what their experience of living in a care home was like, how independent they felt, whether they were being treated with respect, whether their dignity was affected, whether their families came in. There's a whole range of questions there. That was good. But also, part of the team, the interviewing team, we met, and there were people on the team. There was a guy there who had actually managed care homes, and his grasp of care home provision was so sophisticated that sitting in a room talking through what we were going to do with him in the room was such a learning experience that it was just great. I just learnt so much from him about how to be in a care home, how to look at what was going on in a care home, how to think about it, and then you could come back to him with questions from your experience interviewing the residents. So I just found that so interesting and so educational. It was just great. Yeah, I love that.
I'm Jim, Chairman of Carers in Nottingham. I try to help the little person who can't speak for themselves. Well, I can say a lot, but Healthwatch can say a lot more. And that's the whole point of it. You've got to get the word out that people can have a voice. And that's what Healthwatch do. Healthwatch can pass the message on from the smaller person up to the bigger person. And they've done it on various sections. They have had quite a few bits where we've got the message out and asked for the comments, and it's come back, and they've had to press it to government, and they've had to do something about it. We've all got talents. Mine's my math. And, you know, that's the point. Volunteering for Healthwatch is a damn good reason, because they do a good job. Simple as that. Good old Healthwatch, well done. Keep doing it.
Okay, my name is Omo Mariwa Omotayo. My first name is Omotayo anyway. I'm a dentist back home in Nigeria. But you know, when you're in the UK, you just have to put that aside because you don't have what it takes to practice. So I'm actually running a master's program in public health at the University of Nottinghamshire. And well, one of the reasons why I had to choose to volunteer was because as part of the course models I'm actually carried out in my school, there's a particular model which I need to do a voluntary placement. So I needed to find a place to do the voluntary placement. I went online to do some little research, look at the organizations I could actually volunteer. After reading through the profiles, their reviews, after reaching out to the volunteering manager, she made me understand, okay, these are the things we'll be able to offer. Is it in line with what your expectations are? And then it was just a perfect match. Exactly what I needed at the time I wanted to do volunteering. Things I knew that could actually help my practical and employability skills when it comes to public health. So Healthwatch Nottinghamshire is actually the best place to really do volunteering. Healthwatch has given me the opportunity to be able to reach out to the community, to be able to have a feedback of what the people feel else holistically, in the holistic view, what it entails and how you can give back to the community, how you can help make the health a better place for everyone, and quite a whole lot of things really.
Okay, so that's just 3 of our amazing volunteers. The guy that David mentioned in that video, the guy who knows about care homes, was actually here today. He was, Kevin. He was here. He may come back. Okay. So Kevin has led visits to services and continues to work on a number of our projects. You will also see around the room some snapshots of volunteers. They all do different things. Some have been with us for a long time. You know, we've got Julie over here. She was one of our first volunteers, still continuing to support engagement events. Chantel, one of our Maternity Voices volunteers. We've got Blake down there, one of our young people's communication volunteers. And Blake works with our other young volunteer, Edie, to review our documents to see if they're engaging and understandable to a younger audience. We also have information about Tim, Lorraine, Anne, Helen. And, you know, if you have a look round, you can find out a bit about what they do for us and why they do it. And also, there are a few more volunteers in the room today. So we've got Paul, he's down at the back there. We've got Andrew, somewhere, yeah. We've got Sahar, we've got Chris, and Tim. So, if you would like to find out more about how you or anyone you know can get involved as a volunteer with us, you know, please come and talk to me, or there's leaflets at the back, or you could have a look on our website. But I think finally, if you're going to clap when I stand away from this lectern, I think we should clap for our volunteers, because I think they're really worth it instead. So thank you, everyone.
Thank you, Deb, and thank you to all our volunteers who help us be what we need to be. Now, back to that cost of living survey. Thank you to all of you who voted. We've taken the time to count your votes, and the top 3 issues are, at number 1, and I don't think it's going to be a huge surprise, is mental health. I think it's fair to say all of us are very aware that mental health has been an issue throughout the course of this pandemic, and we have not had an opportunity to recover from that when we are hit by change within the system, challenges about actually accessing services, and now on top of that, we've got a cost of living crisis. I don't think we're going to be surprised that that is going to be perhaps the biggest single issue that we are going to have to deal with, against a backdrop of we already know that there is a real challenge of accessing services. The other 2 of the top 3, heating your home and eating well. So the practicalities of living day to day. It is interesting to note that organisations particularly raise the concern around eating well. So I think we're looking here at issues around general health, and this will lead to us demanding as a community more services. We'll take on board your feedback in planning ahead. So again, thanks for all your contributions. I'd now like to introduce my colleague Nadine Otting. She will talk to you around our work alongside and supporting the Maternity Voices Partnership. As you may imagine, this work has taken on a much greater significance with events both locally and nationally around maternity services. Nadine.
Hi everyone. So today I'll be talking about a piece of work that Healthwatch Nottingham and Nottinghamshire completed for our local Maternity Voices Partnership. The Maternity Voices Partnership, also abbreviated MVP, is a working group of NHS professionals, other professionals who support new and expectant families, volunteers, and the families who use the services, who come together to make maternity services better. The piece of work I'll be talking about is the Ethnic Minorities Working Group. So why is this work important? Well, research shows there are persistent racial inequalities in health outcomes for pregnant women and their babies, with Black women 4 times more likely to die in pregnancy or during birth than white women. And it's not surprising when we look at these inequalities in health outcomes that this is reflected in women's experiences of maternity care. So a recent survey, the Black Maternity Experiences Survey, showed that Black and Black mixed women in the UK experience discriminatory practice throughout all stages of maternity care. Here's one example of that report. First visit, a nurse said she was shocked I knew who the father was, as people like me usually don't know, and this was feedback from a Black woman. I'd like to now share with you the experience of a local mother who had maternity care in Nottingham. I very much like to thank Natasha for making this video with us.
My name is Natasha. I am mum to Zaya, who is now 7 months. I'm of mixed heritage, and Zaya was born at City Hospital in Nottingham, born in June of 2021.
How was your experience of care during your pregnancy?
My initial care in the community, so going to my community midwife, I didn't really have a great experience. I kind of felt quite fobbed off. I had concerns with my iron levels, and she says, oh no, I won't do a test until you're 25 weeks. And it turns out my iron levels were, incredibly low. I remember when I'd had low iron previously, I felt the same way. So, but she wasn't reassuring, didn't want to answer my questions, being like a nervous first time mum. Not a great experience in the community for the first half of my pregnancy. And I was seen by a senior midwife in the community after that. And that experience was a lot better. I felt more reassured. I didn't feel like I was a hindrance or that, I was treated as if somebody who's not educated, or I don't know. I just felt like she treated me like I was stupid, or maybe how you'd speak to somebody who English wasn't their first language. I just didn't feel right. And I think probably as well because of the area that I live in, and the doctor's surgery that I go to is in a deprived area. I think yes. I was treated differently to perhaps somebody who lives in West Bridgeford or, you know, something along those lines.
What was your birth experience like?
In terms of the birth experience, the midwife that was attending at the time, her knowledge of using things like birthing balls, stools, and she just seemed to have no clue. But I was told when I was attending the antenatal classes online that the hospital would have, you know, different equipment available to support birthing, and there'd be things like TENS machines available and so on, but nothing of that. There was nothing there, basically. I had to give birth sitting down, which I didn't want to. I wasn't able to move around, which is, they say, you know, it's having an active labour and actually moving around is more beneficial. And I couldn't. So it wasn't a bad birthing experience, but it wasn't what I wanted. I was in hospital from the Sunday. I gave birth on the Thursday. I was told on the Sunday that a paediatrician from neonatal care would be coming to see me. When this didn't happen, I requested for this as well. And I didn't see anybody until I was in labour, having contractions, you know, every 2 to 3 minutes. And she was trying to have a really important conversation with me whilst I'm, you know, in this, you know, in the throes of giving birth. But yeah, whilst I was in labour, that wasn't the right time to be kind of like having any conversation about what's going to happen after, when that conversation could have been had 5 days before. During my birthing experience, I don't feel like COVID rules were adhered to. There wasn't any testing. My partner was an hour away. He came to the hospital, but in the meantime, they'd let somebody else in the room who wasn't my birthing partner. It was a member of my family, but it wasn't my birthing partner, and it wasn't somebody that I wanted to be there.
Is there any advice that you would give health professionals about how to support pregnant women from an ethnic minority background?
I think managing pregnant women's expectations of, you know, the care that they're going to receive, asking them about, you know, have they got any religious or cultural, you know, requirements, anything along those lines, really, and just having some training and knowing what concerns that we would have. For example, I have fibroids, which women of colour are more susceptible to have than white women. And it wasn't until after I'd had the baby that I was told that actually, if you have fibroids, you're more likely to have a premature baby. And I had no idea about this.
So a great video to show that importance of listening and working with ethnic minority families. So what did we do? We set up a working group of staff, volunteers, and service users from Black, Asian, and other minority ethnic backgrounds. Together as a group, these people reviewed national report recommendations regarding maternity care improvements and research for minority ethnic communities. And together, with both the staff views and the service user views combined, they made recommendations for Nottingham University Hospitals and Sherwood Forest Hospital's maternity services. So who was involved in this group? 10 out of the 11 members were from a minority ethnic background. 8 out of the 11 members were mothers or people representing new and expectant families, for instance, having a lot of contact with new and expectant families in their voluntary work. And 3 out of the group members were local NHS maternity staff. What were the recommendations? Firstly, to prioritize families from minority ethnic groups when implementing improvements such as personalized care plans, continuity of care, and antenatal education. To engage with families from ethnic minority communities when developing new services or updating existing services. Thirdly, to co-produce easy-to-read resources so that everyone has access to the information they need to make informed choices about their maternity care. To enrich the maternity workforce with bilingual staff, and review current training and deliver regular interactive training, either online or in person, in cultural competency, unconscious bias, and/or equality and diversity training for maternity staff. And lastly, to liaise with universities and review the cultural competency, unconscious bias, and/or equality and diversity training provided during the midwifery courses. So what difference have we made? Well, the Nottinghamshire Maternity Voices Partnership now has representation from the University of Nottingham Midwifery, ensuring that the feedback that this partnership hears is brought back to the midwives of the future. Sherwood Forest Hospital's NHS Foundation Trust has gone ahead and completed cultural competence training for their maternity staff. And importantly, this training involved a train-the-trainer element, so there are now people within their organization to pass this learning on further. And finally, the MVP has done further work on personalized care plan, which has also included a continuation of the Ethnic Minorities Working Group. So I think we need to acknowledge that although this was a project, it really is a way of working that we need to maintain, involving ethnic minority people in everything we do. So if you want to know more, you can find reports that Healthwatch Nottinghamshire has produced for the Nottinghamshire MVP on our website. They're all available there. And if you'd like more information about the MVP, our local MVP has its own website as well, and the link is right there. Thank you.
It's incredible what Healthwatch tries to achieve with the small resources that we've got, that cradle to grave, health and social care, everything in between is what we're here to do. And we can only give you a small snapshot today of the work we do and the work that we intend to do going forward. But I wanted to say thank you to you for attending. I think coming out to a face-to-face event when we're still all quite concerned about health is a brave thing to do, so thank you for doing that. I want to say thank you to our speakers. Jacob from Healthwatch England, thank you for really giving us an example of how we can elevate voice at a national level, bringing what we do here at a local level to create 7,000 experiences that then can be used to really influence government and the way that policies are made. Was really inspiring and makes us really help us connect with what we are doing here at a local level and the difference we make here to what we can do at a national level. Abdullah demonstrated, I think, that when we look at anything to do with health, diversity has to be at the heart of it. When we looked at GP access, diversity of methods of how we want to meet with our GPs really resonated, that we are creatures of habit. We like to do things the way we've done them, but the world is changing. So how can we work with GP practices as a system to enable people to make the most out of the opportunities to meet with GPs? And so Lucy, obviously with some of those staggering figures of the changes that are happening to the GP landscape, really brought to life, I think, just what the scale of the issue is and how difficult it is for people to access services at the moment. Deb brought together a whole raft of volunteers to demonstrate to you the different things that we do, from the posters around the room to the fabulous film that was also filmed by one of our volunteers, Chris. So thank you to Chris for doing that. And Nadine, who again brought together how engaging with people who are at the really the part of our health system that get very seldom heard, and the experiences that they're facing, how important it is for somebody to listen and then for us to be able to do something about that. So thank you to everybody for the input that you've brought to this event, and thank you for those that are attending. The staff have put, I think, together a really good afternoon for us all to be able to demonstrate what we do and what we achieve at Healthwatch. And I really look forward, as we're moving into a new system, that we are able to continue to elevate and not only do that but amplify, to make your voices louder, and ensure that when we are looking at how things change, that they're listening to your voices and that you can see the result in the changes that come along. So thank you ever so much for this afternoon. We are going to be holding our AGM, which is the business part that any organisation, any charity has to do. You're very welcome to stay for it. It will be a very short meeting where we do some of the business, so you're very welcome to do that. But thank you again for attending, and I really look forward to seeing you again doing something similar to this in a year's time, when we can really look to see what difference we made in a new system across Nottingham and Nottinghamshire. So thank you.